In a hospital, we are literally surrounded by technology that saves lives. But one of our most powerful tools is completely invisible. So think of this as your guide to mastering radiation, not as some big scary threat, but as a powerful ally that, well, it just demands our respect. You're the guardians of safety, and this is your playbook. You guessed it, it's radiation. It's a form of energy that's so subtle, it just completely bypasses all our senses. You can't see it, you can't smell it, you can't taste it. And that very invisibility, that's what makes it such a huge risk if we don't handle it with expertise. Awareness isn't just a defense here, it's our superpower. All right, here's our game plan. We're going to start by looking at the dual nature of radiation, how it's both a lifesaver and a potential hazard. Then we'll dive into its hidden effects, figure out how to shield our most vulnerable patients, and master the 3 golden rules of safety. After that, we'll define your critical role, and finally, talk about how we can all work together to build a rock-solid culture of safety. Okay, let's kick things off with a really important shift in how we think. Don't see radiation as just another medical procedure. You got to think of it as a powerful, double-edged sword. It's an absolutely essential tool for diagnosis, but it's one that demands our full attention and, honestly, our unwavering respect. So, what is it really? At its core, radiation is just energy on the move, and it lets us see inside the human body with unbelievable clarity. But, and this is a big but, it's a silent force. Our senses are no help here, which means we can't just rely on instinct to stay safe. The only things protecting us are knowledge and just plain discipline. This image right here really gets to the heart of our responsibility. Every single time, we're balancing this scale. On one side, you've got the huge diagnostic benefit for our patient. On the other, you've got the potential risk. Our whole job is to make sure that scale always tips towards the benefit side. And the way we do that? With rigorous, uncompromising safety protocols. Now let's look past what's right in front of us. The effects of radiation, they go way more than just skin deep. We've got to explore the invisible impact, the long-term consequences that can shape not just one person's health, but their entire future, and maybe even the generations that come after them. When we think of radiation harm, our minds usually jump to those immediate, what they call somatic effects from a high dose, things like skin burns or losing hair. Those are the direct physical effects on the body, and yeah, they are incredibly serious. But in a hospital setting, our biggest worry is often the sneakier threat from lower, repeated doses that add up over time. And this slide shows a really stark contrast. On the left, you see the visible, painful proof of radiation damage. But on the right, that's the invisible and honestly far more concerning threat, damage to our very DNA. This is the silent enemy we're up against, the one that has the power to literally rewrite our future. And this is where our responsibility gets so much deeper. See, radiation safety isn't just about the patient right in front of us today. When reproductive cells get damaged, that genetic legacy can actually be passed down. So our duty goes way beyond this present moment. We are guardians of the health of generations that haven't even been born yet. This brings us to a super important question. Who are the most vulnerable people in our care? So let's focus now on how we identify and give extra special care to the patients who are at the highest risk from radiation exposure. Okay, 2 groups demand our absolute 100% vigilance. First up, children. Their cells are dividing and growing so fast, which makes them especially vulnerable to the long-term effects of radiation. And second, pregnant women. In this case, any exposure poses a direct and very significant threat to the developing fetus. I want you to think of this sign as a hard stop. It is not a suggestion, it's a critical checkpoint. For every single female patient of childbearing age, you have to confirm their pregnancy status before any procedure. It's an absolute must. This one simple question is an incredibly powerful way to prevent profound and permanent harm. And for procedures that aren't an emergency, we have an amazing guideline, the 10-day rule. Now, why is this so important? Well, it's because in those first 10 days after a menstrual period starts, the chance of an undetected pregnancy is at its absolute lowest. Sticking to this rule is a simple but profoundly effective way to protect a potential new life. Okay, let's switch gears a bit and talk about protecting ourselves. Your safety and the safety of your coworkers, it all comes down to 3 simple, powerful, and easy-to-remember principles. These are the 3 golden rules of radiation safety, and they are totally non-negotiable. It's a really simple mantra. Time, distance, shielding. First, minimize your time near the source.
Less time means less exposure. Simple as that. Second, maximize your distance. The farther away you are, the weaker the dose gets. And third, always use shielding. Lead aprons, barriers, those are your armor. Never go into that room without them.
Let this number just sink in for a second. 100 times. A single chest CT scan can expose a patient to 100 times the radiation of a standard chest X-ray. Now, it's an unbelievably powerful diagnostic tool, but with that great power comes great responsibility. Using it has to be a carefully considered medical necessity, not just a routine check. So let's talk about where you fit into all this. You are so much more than just an employee. You're a guardian. You're a protector of your patients, your colleagues, and yourself. You are an absolutely essential link in the chain of safety, and that chain is only as strong as you are. This is something you really have to get into your head. Radiation exposure is cumulative. It's like a debt that just builds up over a lifetime. Every quick checkup X-ray, every let's just be sure scan adds to that total, increasing the long-term risk. And that's why every single exposure has to be a deliberate, medically justified decision. Okay, so here it is, your Guardian's checklist. Pay attention to every single warning sign. Follow all the safety procedures to the letter. Wear your protective gear without fail. Always verify pregnancy status and the last menstrual period for every female patient of childbearing age. And, this is crucial, any request for a voluntary or a repeat scan, that has to go to the doctor, no exceptions. And finally, let's just zoom out for a minute. This isn't just about what you do as an individual. This is about us building a collective commitment, a true culture of safety that becomes the lifeblood of our hospital, flowing through every single department and every team member.
This right here is the blueprint. This is what a future-focused culture of safety looks like. It's built on 4 main pillars: shared awareness, unwavering discipline, absolute medical justification for every procedure, and consistent, team-wide safety practices.
And hey, here's a proactive little tip to support your own health. Radiation exposure can create these unstable molecules in your body called free radicals. A diet that's rich in antioxidants, which you find in fruits, vegetables, nuts, seeds, can actually help your body neutralize these free radicals and boost its natural repair systems. It's a simple, powerful thing you can do. And so we end right where we started, with you. That delicate balance between risk and benefit, between healing and potential harm, it really does rest in your hands. You have the knowledge now. You have the responsibility. So the question isn't if you'll act as a guardian of safety, but how. How will you protect your patients, yourself, and all the generations to come?